Hi, my name is Haley Stuckey, and this is my presentation on cohort and case control studies. So the cohort study is a prospective, retrospective, and ambidirectional cohort studies are the options. There's also general and special cohorts. Some of the strengths include efficiency for rare exposures, and they are able to study multiple effects outcomes at the same time. Limitations include that they can sometimes be expensive and time-consuming, and they also could require large numbers of subjects that need to be followed for long periods. So an example of a cohort study, the article that I chose is The Impact of Work Loss on Mental and Physical Health During the COVID-19 Pandemic, Baseline Findings from a Prospective Cohort Study by Daniel Griffiths and others. This was a prospective longitudinal study conducted through a survey. They had 18 and older do a call-in survey, and then they split them into groups from there. Just to save time, that's all the information I'll give on that one. So the case control study is best when there's little known about a disease, if data is difficult or expensive to achieve, or the population is difficult to follow. The article, Healthcare Disparities Among Persons with Comorbid Schizophrenia and Cardiovascular Disease, a Case Control Epidemiological Study by Gall, Muntz, and Lavav, is a great example. It uses previous designs by prospective historical design and data that was gathered between 2000 and 2009. They were able to collect data about sociodemographic, medical diagnosis, laboratory tests, drug utilization, and surgical interventions. So some of the uses that I could see in public health, specifically the case control, would be that anything new, such as, COVID, we knew nothing about it, and it needed to be done on a large scale. I could see how that would be a very useful thing. And cohorts are just amazing for those long periods of time. So to continue on that research that you would begin on a new disease. Here are my references. I apologize for my voice. I am quite sick at the moment, but I hope that you enjoyed the presentation. Thank you.